we're going to talk a little bit about elbow pain. This is a really common symptom we see primarily with laborers, people that use their hands a lot. Think about people that are carrying a lot, lifting a lot, manipulating things with their hands, but also going to be happening from people that sit a lot, people who work at a desk a lot, right? As we get into this rotated position, they get some strain on this lateral part of the elbow here on the outside. And then it might present in other ways. It could present when we're doing pull-ups, it could present when we're riding a bike, it could present when we're picking up our kids. So we call this tennis elbow when it's pain on the outside of the elbow. It's also called lateral epicondylitis, so lateral meaning outside. Epicondyle is the correct name for the bony prominence on the outside of the elbow, and anything itis means inflammatory, right? So it's irritated, it's hot. So what we know though is that the muscles that run on the outside of the elbow run to the back of the hand. So anything that we lift up our hand with, anything that we extend our wrist with. Sometimes people don't notice this though because they think, oh, I have trouble with my grip, right? But if you don't have balance between the muscles that extend the wrist and extend the fingers and muscles that flex and grab, sometimes you might have that pain with your grip, but it's actually problems with pain on the outside of the elbow. So we call this a tennis elbow. So one way that we want to work on using our favorite tool, lacrosse ball, is to mobilize some of that tissue. We want to get that stuff to move, get it softer, get it to calm down. First of all, when we need to calm it down after we're done our exercise, after we're done straining it, whatever it is we're doing, icing is a super important thing for this, right? Anything itis, inflammatory, it's hot, we want to calm it down. We know ice 4 times a day or more. Not necessarily even putting an ice pack over it, but maybe taking an ice cube and ice massaging it. Maybe have a towel nearby because it'll generally start to drip and start to make a mess. But you want to keep wiping it off and continue to use the ice. So what we can do though with the tennis ball is, with the lacrosse ball, is that we want to compress that the same way we do with some of the other structures in our body and then start to move around it. I'm going to do it with my right arm because I think it's easier to see in this position, right? So I want to have my palm up and I want to put that lacrosse ball right underneath that muscle of my outside of my elbow, and then I can use my opposite hand to kind of compress it, right? And find my spot that it's a little bit irritated, and then I can work on moving my wrist forward and back, right? Maybe I need to open and close my hands. Maybe it's a sequential finger motion, right? Maybe I want to turn my wrist over and back or move my wrist side to side, right? And as that loosens up, I can move to a new area, continue to do it, move to a new area, continue to do it, and that'll start getting some mobility in that forearm area on that lateral elbow. Now, if that's going well, but I still want to work a little more intensely, I can actually take a second ball and I'm actually going to almost pinch it between the 2 balls, right? So I'm going to put the ball on top, 1 ball on the bottom, and I'm going to kind of press together, and now I can really grasp that tissue and mobilize it through wrist mobility. I could try to mobilize it through moving my shoulder and bending and straightening my elbow, but really because these muscles attach from the elbow and below, really that wrist mobility is going to be the best way to do that. So that's a way that you can kind of start working on that mobility of the elbow. You could do it if you can't tolerate that pressure where you're sitting, and you can actually, now I'm palm down, right? And I can just kind of hold pressure on it myself and try to mobilize it like that. Right? I would also suggest if you're having problems with this side of the arm, you should probably work the inside of the elbow too, where all those wrist and hand flexors come from. So same idea, I'd be there, kind of compressing on there, maybe lean my weight on and moving that forward and back, moving that forward and back, right? Because I need to get that balance of the muscles on the outside of my elbow and the inside of my elbow, because that's what creates my grip strength. If either one of those is irritated, I'm gonna have painful and dysfunctional grip. Try those out, see how that works.